Hey guys, this is Caesar with Nursing School Made Easy, and today's lecture is going to be on gastritis, or inflammation of the gastric mucosa. So again, we're talking about the stomach, so make sure you picture that. Try to picture that in your brain. What part is being affected? And we're talking about the stomach, so look at the location. Let's make a real quick drawing here. I already started on it. So we have the head, arms, shoulders, chest, now the esophagus, right? So the mouth here. Eventually this is going to turn into the stomach. So where's this location? It's right in this epigastric region, and it'll come into the right upper quadrant. Okay. Also remember that anytime you eat, food's going to go into the stomach, come down, and then it's going to reside in the stomach for a little bit of time. So this may be between I don't know, maybe 5 to 30 minutes. Now that is going to play a factor here shortly. Okay. So again, we're talking about gastritis. Again, inflammation of the gastric mucosa. So what are some causes? I have some of these written down already. Number one, NSAIDs. Now these include your ibuprofen, your Motrin, any type of over-the-counter pain medication. So again, if your patient is taking ibuprofen, Motrin, things like that, you want to tell them to be careful, because one of the side effects may be inflammation of the stomach or irritation of the stomach. Another medication would be something like naproxen, aspirin. Now aspirin, you have to be careful with aspirin, because patients that are taking aspirin may be patients with some type of cardiac issue. So if their physician told them, you know what, take a baby aspirin on a daily basis, well, one of the side effects of that would be irritation to, again, the stomach. Also a patient that is taking digoxin or Fosamax, both of these irritate the stomach lining, or the gastric mucosa. Again, we talked about naproxen or Aleve. Patients also taking, jumped in number 2 there, corticosteroids. So if they're taking corticosteroids for some type of inflammation, some type of arthritis, some type of autoimmune disease, one of the side effects again is stomach irritation. Another thing to look at is alcohol. Is a patient a frequent alcohol user? Are they consuming alcohol for prolonged periods of time? Is there any chronic alcoholism? Again, alcohol is going to irritate the stomach. Number 3, spicy foods. Number 4, some type of bacterial infection. In this case, the Helicobacter pylori or H. pylori infection will cause gastritis. 5, some type of stomach surgery, some type of resection will have an effect on causing some type of gastritis. Number 6, autoimmune disease. Now we talked about our little image here, and this is going to focus on our clinical manifestations. So let's move to those. So number 1, anorexia. Now why are you going to have anorexia? Okay, if you consume something roughly between, let's say, 5 to 30 minutes after you eat, you're going to have some pain, because it's going to take some time for that food to get down, sit. It's going to take some time for your stomach to produce those acids. The acid secretions are going to, again, irritate the stomach. So again, this may take 5 to 40 minutes to occur. So you will have anorexia because anytime you eat, you're going to have pain. So people are going to try and avoid pain. Therefore, they will begin to eat less and less. Along with this anorexia, anytime that irritation occurs, you may also have some nausea, vomiting. So we'll call it number 1, we'll call nausea, vomiting number 2. Now, look at where this sits. So number 3, you're going to have some epigastric pain, epigastric tenderness. Again, this could be in the epigastric region or also in the right upper quadrant region. Okay. Now, in patients, for example, where the gastritis is severe enough or chronic enough, you will actually get some ulcerations. Those ulcerations could lead to some bleeding. So you'd want to make sure that you assess your patient at all times for GI bleed. You cannot rule that out. So please pay attention to your patient's vital signs. Make sure that you assess their capillary refill. Make sure you assess their skin color. Are there any changes? Are they becoming cyanotic? Their blood pressure, is there any changes in that? Their pulse, is it weak? Is it thready? Their O2 sats, how are those? Their bowel sounds, are they active? Are they hypoactive? So those are some clinical manifestations. Number 5, pernicious anemia. Now, why pernicious anemia? Well, if your gastric lining is being affected, remember, part of the lining is covered by parietal cells. So if those cells are damaged, you can no longer produce intrinsic factor. If you cannot produce intrinsic factor, then you cannot absorb cobalamin, so you will suffer from cobalamin deficiency, which is pernicious anemia. Again, this would be more of a chronic gastritis. Now, what are some diagnostic studies that can be done? Number 1, an endoscopy. So they'll put a tube in, come in, check out the esophagus, and also look at the stomach lining, check for any ulcerations, any perforations. So that would be number 1, endoscopy. Number 2, you will test for H. pylori. You will test to see what is causing the infection, if there is an infection present. Now, when you test for H. pylori, you can either do urine, serum, or stool samples. That's number 2, which is, again, test for H. pylori. Number 3, you will also check the stools for blood, because, again, you want to make sure that you're not missing a potential bleed or an active bleed. Okay, so you will check the stools for blood. Now, what are some interventions? What will you do for your patient? Number 1, if they come in to the facility, they may be placed on NPO status. Now, the reason they're placed on NPO status is because anytime they eat, they may get some pain. They may get nausea, vomiting. So you want to prevent that from occurring. So you will let the stomach rest, let it heal a little bit. So again, you'll place them on an NPO status. Number 2, you will give IV fluids, especially if they haven't been eating anything, if they've been anorexic, especially if they've been having some nausea, vomiting. You want to replenish those fluids, so you will give them some IV fluids. So you will also have to start an IV. 3, you'll give them antacids. Along with that, you will give them their PPIs, or proton pump inhibitors. They're H2 receptor blockers. Now, we talked about some of those in a previous lecture, so review that lecture. Again, with your antacids, if you're giving them aluminum-containing products, you want to watch out for constipation. If you're giving them magnesium-containing products, you want to watch out for diarrhea. So again, you're going to have to educate your patient on these, okay? And remember that the PPI, some of those cause headaches. So again, make sure you know your medications, and again, educate your patient. Number 4, you're going to provide some type of antibiotic therapy, especially if it turns out that the patient is suffering from a H. pylori infection. Again, you're going to have them take their antibiotics as prescribed. Number 5, you're going to make sure that you inform them of their cobalamin therapy. Again, they are unable to produce intrinsic factor, therefore they will have cobalamin deficiency. So again, you will have to tell them about cobalamin therapy. Number 6, you'll tell them to stop smoking if they smoke, stop drinking if they drink alcohol. You tell them to avoid coffee, avoid caffeinated beverages, avoid tomatoes, because again, all of these things irritate the stomach, so you want to let the stomach rest a little bit. So you may also put them on a clear liquid diet, and again, this will be up to the physician. Again, if you do put them on a clear liquid diet, you want to avoid anything that has some type of red or purple dye, because again, you do not want that red coloring to give you a false positive for a GI bleed. So again, you would stick to your obviously clear liquids, your oranges, your yellows. Again, you don't want to think you have a GI bleed when you don't.